Hi, my name's Clarissa, and today I'm going to be talking to you about AIM Therapy, providing a summary of their services whilst highlighting interprofessional practice. AIM Therapy is a private clinic that provides therapy for children through a range of multidisciplinary services. Their vision is to offer equal opportunities for all children and families to develop goals unique to them and have access to the support they require in achieving these goals. AIM Therapy receive funding from the National Disability Insurance Scheme, Department of Families, Housing, Community Services and Indigenous Affairs, Medicare and private health. The services offered to customers highlight multidisciplinary assessment, group therapy, face-to-face or online, holiday programs and school services. Occupational therapy services at AIM are provided to children and adolescents experiencing a range of conditions including developmental delay, difficulties surrounding learning, attention and mental health, physical disabilities, intellectual disabilities, insufficient social and/or play experiences, Fragile X syndrome, cerebral palsy and Down syndrome. Occupational therapy services offered at AIM Therapy include strength, coordination and gross motor skills, life skills and activities of daily living, attention and concentration, handwriting and fine motor skills, managing emotions, managing sensation, organisation and study skills, balancing daily activities, visual perception for reading and spelling, problem solving, self-care activities, and social and play skills. Speech pathologists aim to assist children to speak, listen, understand language, read, write, and use social skills, whilst also supporting children with a stutter, voice disorders, or difficulty surrounding eating. Speech pathologists at AIM work with children with a range of disabilities, including autism spectrum disorder, global developmental delay, intellectual disability, and cerebral palsy. Interprofessional practice highlights healthcare professionals with differing expertise, education, and training working together on behalf of patients towards a common goal. Through communication, coordination, cooperation, trust, and collaboration, patients are able to receive safer and higher quality care. Mistakes are more likely to occur in patient care when healthcare professionals do not collaborate and communicate poorly. Therefore, practice as part of an interprofessional team enables patient safety, a safe patient environment, and less opportunities for mistakes. At AIM Therapy, patient safety is enabled through effective communication and collaboration across the various disciplines. Interprofessional practice at AIM Therapy enables health professionals to communicate easily with other disciplines regarding patient care and working towards achieving patient goals. The benefits of interprofessional practice at AIM Therapy include higher quality patient care, improved clinical and patient outcomes, improved cost effectiveness, and overall enhanced staff and client satisfaction. At AIM Therapy, speech pathologists and occupational therapists collaborate when providing therapy that teaches children skills around feeding or eating, handwriting, social skills, and communication. For example, occupational therapists can support children in feeding through providing adaptive equipment, strategies around food textures, and recognition or awareness of hunger sensation, while speech pathologists can support children through providing strategies for swallowing, highlighting modifications to diet, postures or maneuvers, and safety. When collaborating interprofessionally with a client focusing on handwriting, occupational therapists will provide services highlighting task analysis, adaptation, and environmental modifications, namely adaptive technologies such as pencil grips. Speech pathologists will provide services that also develop handwriting skills with a greater focus on comprehension and semantics, as well as the production of written language. Social skills can potentially be developed in patients through occupational therapists and speech pathologists co-facilitating a social group with children on the autism spectrum, for example, whereby they are given opportunities to interact and engage with each other in a safe and supervised environment. Occupational therapists and speech pathologists can collaborate when providing therapy for patients with complex communication needs through the implementation of augmentative and alternative communication strategies, or the AAC. The AAC is a collection of strategies that support comprehension and expression when verbal language and cognition are impaired, thus requiring the collaboration of both occupational therapy and speech pathology. Through effective communication and collaboration techniques, occupational therapists and speech pathologists can work together to provide clients with the safest and most effective care and therapy, ultimately aiding their development across all these areas. When on a fieldwork placement, occupational therapy and speech pathology students could work together with the client to create an intervention plan that details the therapy to be provided for developing skills around feeding and eating. Occupational therapy students would be required to consider the appropriate environmental modifications to promote effective feeding, highlighting assistive technologies, location, timing, seating, and lighting, whilst the speech pathologist could implement techniques and strategies such as consideration of diet and posture to encourage swallowing in a safe manner, therefore combining techniques across the two disciplines to assist their client in achieving their goals. Occupational therapy and speech pathology students could also co-facilitate a social skills group for clients with a common diagnosis, whilst under the supervision of their fieldwork supervisor. The group would be planned in detail by the students, which would provide opportunities for the children to interact and learn social norms such as sharing and turn-taking. When supervising interprofessional student fieldwork placements, supervision teams should agree on learning outcomes and goals with all students across all disciplines, with a significant focus on collaboration. This will limit the potential for conflict and competition between disciplines, creating a sense of equality throughout the students. Supervision teams are required to effectively plan to enable responsibilities and tasks to be shared between students. In order to effectively manage and supervise students, supervisors need to be transparent and realistic about their expectations, whilst also being supportive and sensitive of the students' needs. The fieldwork environment should be safe and challenging in order to promote independence, development of clinical reasoning, self-reflection, and self-directed learning in the students.